Welcome to the Nurse Perspective, where we delve into the vital intersection of healthcare, community, and public health nursing practices. In each episode, we'll explore a wide range of topics, from preventative care and health promotion to disease management and community engagement. We'll have special guests talking about specific topics near and dear to their hearts, and individuals with lived experiences, shedding light on the challenges and successes of public health. Let's meet the team, starting with your host.
Hello, my name is Jackie Haley, RN, and I'm the Clinical Section Manager at Two Rivers Public Health Department, and I oversee nursing and all things clinical.
Hello, my name is Jordan Anderson. I am an RN, a community health nurse, and I am in charge of the STI program and the VFC-VFA programs.
Hi, I'm Rosa with Two Rivers Public Health Department. I am an LPN and I am a disease investigator, and also I am your local TV nurse for our jurisdiction. And I also speak fluent in Spanish, so if you need our assistance, feel free to call.
Hi, my name is Liz Weens. I'm a community health nurse at Two Rivers Public Health Department. One of the main roles I fill is I am the lead nurse for lead investigations in our jurisdiction.
My name is Marilyn Warnkin. I'm an LPN. I am a program nurse at Two Rivers Public Health Department. I am in charge of immunizations, and also I do poop.
Whether you're a seasoned public health nurse, a healthcare professional, a student aspiring to enter the field, or simply interested in learning more about the critical role of nursing in public health, this podcast is for you.
Welcome back, and thanks for tuning in. I'm Jackie Haley, and today we will be talking about a Health Alert Network update from Nebraska Department of Health and Human Services on West Nile virus in Nebraska, the increase of enteric infections that Two Rivers has been seeing in our district, and our guest speaker this time will be Ashley Green, and we will be talking about something called rabbit fever. So first off, a Health Alert Network update on West Nile virus within Nebraska. So just for some background, in 2023, we had about 150 West Nile virus human disease cases. And 61% of these cases, or 91 out of that 150, they were classified as severe neuroinvasive disease. So what does this mean? This means that West Nile affected the brain or caused neurological dysfunction. And when that happens, that virus enters the central nervous system, and then that can lead to hospitalization and death. And speaking of death, in 2023, of those 150 West Nile cases that were reported in humans, we did have 10 reported deaths. So we look at that. That's very important information because that tells us that, how bad it is for that year. So when we see West Nile in Nebraska, we generally start seeing it mid-July. And the peak of when we have the most cases is around Labor Day. And then we usually start seeing the cases disappear mid-September. So most of these infections for West Nile are asymptomatic. So that means there are no symptoms. So you don't even know that you have it. But if you do have symptoms, then you would have like fever, headache, fatigue, muscle or joint pain, skin rash on the trunk of your body, swollen lymph nodes and glands, and eye pain. And why this can be so hard is there are a lot of different infections that you get that have those exact same symptoms. So what you really need to remember is if you've been outside or if you remember having a mosquito bite, you need to be watching yourself for 3 to 14 days, because after that is when you usually would get symptoms. And if you do get symptoms and it is correlated to that mosquito bite, it could be West Nile. And if you are having those symptoms, then you have a higher chance of having to be hospitalized or, needing further intervention. So basically, everybody just needs to know if you do get mosquito bites, make sure you know that date and then watch yourself. And if anywhere in between there, that 3 to 14 days you have symptoms, you need to contact your medical provider and let them know. That way you can be tested. So moving on a more local scale, we've had an increase in enteric infections. So enteric infections are intestinal illnesses caused by bacteria, viruses, or parasites. And they're more common in the summer. So what's really interesting to me is, why would any disease be more common in the summer, right? So there's actually 3 different reasons. The first is because it's the summer, it is warmer and more humid weather. And that warmth and that humidity encourages growth of bacteria. And the second thing is pathogens contaminate water or food or drinking water. And they're there because it's warmer and more humid, and they can grow because that water is warm. The third is people are spending more time outside, right? So we are eating and cooking outdoors, which leads to less than ideal sanitation, right? So say there's standing water around, or you touch things, you don't wash your hands, and so it can enter in your body more because it's not as sanitary and clean. So long story short, in the summer, we do have an uptick of enteric infections. We always do. We are seeing it. So the things that you need to do for the summer is make sure that if there's any standing water, that one, if it's like a pool, make sure that it is being cleaned appropriately and has the correct amount of chlorine. If it would be like a tank for animals, make sure that you're not, putting your hands in it or drinking out of it. And if you do, make sure and wash your hands correctly. And then if you're eating outside, you need to use more sanitary conditions. That way you're not infecting yourself. So also just know where you've been and what you've done, because if you do get an enteric infection, sometimes you might have one of us disease investigators call you and ask you all sorts of information about what you ate, where you've been, and that way we can kind of get down to the bottom of how you potentially could have got that infection, and if there would be other people that would have that same infection due to how you got it. Joining us now is Ashley Green, Environmental Health Specialist here at Two Rivers Public Health Department. Hi, Ashley. Before we jump into the nitty-gritty, tell us a little bit about you.
Hey, Jackie. So I'm excited to be on the podcast today. So again, my name's Ashley. I'm the Environmental Health Specialist here at Two Rivers. I just joined the team about 6 months ago. Actually, pretty interesting about me is that I was a vet tech before I worked here at the health department. And I think that has taught me a lot about my current job and dealing with vector-borne disease and zoonotic disease. So I'm excited to chat with you about it today.
Awesome. Sounds like you're the right person for this. So, okay, the nitty-gritty. So what is tularemia?
So I actually had to do a little bit of learning myself about tularemia. Tularemia is pretty rare in the United States. In my 6 years working as vet tech, I had never heard of tularemia.
Wow.
But essentially, it's a bacterial infection, and it's most common in rural areas. And actually, the states with the highest prevalence of tularemia is Kansas, Missouri, and Arkansas. Oh. So it's interesting that we're seeing it in Nebraska.
Yeah, it is. So there is a little known fact that it's called rabbit fever.
Yeah.
So can you kind of explain why?
Yeah, so tularemia is most common in rabbits, hares, rodents, mammals of that sort. The reason why it's commonly referred to as rabbit fever is because rabbits can sometimes serve as reservoirs. And when we're thinking about vector-borne and zoonotic disease, we think of reservoirs as areas where bacteria or viruses can stay inside of a host and not necessarily make them sick. Now, there have been cases in the United States where a large number of rabbits become infected with tularemia, and there's a large dying off of that group of rabbits. That's why it's referred to as rabbit fever.
Oh, that's interesting. So they're a reservoir, and so how do they spread that?
So it can spread in a lot of different ways, and that's what's really unique about tularemia is that there's a lot of different ways that animals can get it and that people can get it. One of the most common ways that animals get it is through bites of insects. So what we're usually thinking of is ticks usually spread it, deer flies spread it, and sometimes mosquitoes can even spread it, which is pretty interesting. So when you're looking at animal infections, it can be through insect bites. We can also see that it can spread through bodily fluids, so bites from other animals. So if you're looking at like feral cats or, somebody biting somebody else in the wild, fighting over something, that's definitely an option. If, the first animal had tularemia, they can pass it on through the bite. Other ways that we usually can find it is about 10 to 15% of the infections in the United States are actually waterborne. So if there's an area where, the water has tularemia in it, the animals in that area are drinking the water, that can, kind of escalate into a bigger situation. So that's some of the ways that it can be passed on and are the most common ways. It's also can be passed on through like airborne particles, but that's a little bit more of a rare occurrence than through bites of other animals or insects or water.
Right. So you'd have to have like a big, say like you have it in the water, it would have to be like a big massive pile in that water and then, something
right
agitating it so it could get into the air for people to get that.
Yeah. Or it, sometimes we see it in the soil too. If you have an animal who passes away, their carcass is, being fed back into the earth. If they have tularemia or had an active infection before they died, we can sometimes see that dissipating into the soil in the area. People are kicking up soil when they're hiking or animals are digging or whatever the case may be. So sometimes we can see it that way as well.
So what makes it so dangerous?
So what makes it so dangerous is that tularemia is really good at infecting your immune system. So it can get into your lymph nodes, and your lymph nodes are kind of what helps fight a lot of your infections going on in your body. So if it is infecting the area that you need to fight other infections, it kind of makes you susceptible to a lot of other different things happening in your body. So that's why it's one of the most dangerous. It's also pretty rare, and a lot of clinicians don't know what to look for when they're looking for it.
Right.
So sometimes it's caught too late, and at that point, we can treat with antibiotics, but there's not much else you can do about it once it's to a really severe infection.
Right. So if you catch it early, though, it is treatable.
Oh, yeah, it's very treatable. Antibiotics are the most effective treatment for it. And with antibiotics, your fatality rate drops from 5 to 15% to about 1%.
Right.
If you catch it early with antibiotics.
So the key is knowing and testing for it.
For sure.
Awesome. Well, good thing we're given information about it then.
Yes, for sure.
So what do we do if we do think our animals could have contracted this?
So I would definitely recommend, first of all, always make sure that you're monitoring your animals for any signs of illness. With tularemia specifically, since it has so many different ways it can enter the body, there's not necessarily a set of signs and symptoms that I would look for. General unwellness, poor appetite, low energy. With this, you may see a little bit of eye discharge or swelling around the eyes. You may see little lymph node areas swollen on your animal. Usually those are under their armpits. And then with that, just keeping an eye on that. If you suspect anything, definitely call your vet and let them know that they've had exposure to a tick, or they're out roaming, they're helping you hunt, they're helping you monitor your, especially if you have farm cats or whatever that are helping you patrol for rodents. Definitely let the vet know of their usual activities. That way they can bring tularemia into their scope of diagnostics.
Right. So basically, you need to know your pet's risk.
Yeah.
So if they're outside dogs, if they live outside, if they're hunting,
right,
they're more apt. But if you do have an inside dog that maybe brought like a dead rabbit inside or
Right.
something like that.
That would be another thing to
right.
let your vet know about, especially if that's, not usually their usual behavior
Right.
for them.
Right. Awesome.
Yeah.
All right. Well, thanks for joining us, Ashley.
Yeah, of course. This was so much fun. Happy to join.
It was. We'll have you on again, I'm sure. So next time we will have Elizabeth Weens. We call her Liz here. She's a community health nurse, and she'll be educating everyone about National Immunization Awareness Month, along with medical updates, both nationwide and right here at home.